So let me invite Milan to come and answer a question. You've been around for a long time, and we have heard from earlier speakers how the path from the 2009 Council recommendations led to the progress that we've had today, and you were involved in helping to make these activities. What do you think is the best way forward to guarantee that we get a new policy framework? Because the number one recommendation that came out of RARE 2030 is we need a new policy framework. You were involved last time. What can we do to make it happen? Milan.
Well, thank you. Indeed, we need a new policy framework. That's absolutely clear. And I would be really pleased to provide a little bit of a personal touch on what we have done. And we all know that success is a combination of bottom-up and top-down initiatives and a little bit of luck. And I'm a medical geneticist, and I have been involved in diagnosing rare diseases since early 90s. And honestly, we know what it means, a diagnostic Odessa for patients and their families. That's absolutely clear. It's really a very big burden for them. And it's simple. As always, our work has to be genuine. We should inspire others as example. Easy said, but it's hard. It's not enough. And you need to also start educating your colleagues, many of whom even don't realize that they have patients with rare diseases in their clinical portfolio. So gradually you start building a community of likely-minded people, and most importantly, you need to change the culture within which we physicians traditionally operate. That's clear. That is to involve patients, and that's so enriching for us. They are true experts in their diseases, and only together we can build a momentum, and this is the key word, the momentum, and confidently approach together the policymakers. Only patients can demonstrate, unlike us, what is the real burden of rare diseases to them. And only this is the way that together, in a complementary and synergistic manner, to use the EU jargon, we can start the ball rolling. And as always, life brings surprises, right? And as always, serendipity comes into play. So I remember I've been contacted on December 27 in 2008 by the former Minister of Health on the ski slope, but would like to lead the rare disease so-called sector healthcare agenda of the upcoming EU presidency. But we were ready, and we were simply asked to carry the baton forward from the French EU Council presidency. And afterwards, again, it's quite straightforward. It has been hard work together with all the stakeholders, member states, commission, and I cannot say more the valuable contribution from Eurodis. And most importantly now, we don't need to start from scratch. We have the momentum. We just need a new framework. It's clear as this.
Thank you, Milan. How do you think that the Czech rare disease community could play a role in leveraging this and making this happen? You've talked about the need to connect top down and bottom up, but there's also a role that serendipity happens and windows of opportunity open and close. For a lot of people, COVID-19 has been a closing of windows of opportunity. Lots of treatments have been delayed, access to hospital and healthcare has been dropped because of the emergency. But Katarina from the European Parliament thinks it's an opportunity. It's a window of opportunity because people are rethinking what we do and how do we do it. So from your point of view, how can the Czech rare disease community connect from the bottom to the top through this window of opportunity?
Well, as you said, we always tell our policymakers, look, there are marginalized populations, be the elderly in the COVID pandemic. And as Turkle nicely said, that there are these I would say not an epidemic, but these healthcare emergencies all the time, they go unnoticed. So it's not only the visible ones which make the media, it's among us, it's all the time here. And I have to say that I would say the most important part is that we have the European reference networks. That's a very solid basis, but they operate on goodwill and mainly enthusiastic basis. I know most of the people there, from various communities, the European society, but they have minimal financial support, and this is not sustainable. Another thing which hasn't been discussed here is the ongoing generational transition. Our younger colleagues have different approaches to work-life balance, and frankly, I understand them. So we really need a more sustainable ecosystem, or rather even a holistic policy framework. In the beginning, we heard the French Minister of Health, Katarina, just voiced the support on behalf of the EU Parliament, which is very important. Afterwards, we will hear the prerequisites recorded message of our Minister of Health. So, I mean, we keep the ball rolling. There is a clear momentum from the national side. So I would conclude, as I said in my previous response, action really speaks louder than 1,000 words. An absence of action, and this is what I'm really worried about, may revert us to the unfortunate pre-2009 situation. So I can only confidently say on behalf of the entire Czech rare disease community that we will be really pleased to work together with our political representation, with any other European stakeholder, whomever you think of. And importantly, we would really like to make things happen, because that's the only way how to change the things on the ground, irrespective of pandemic or any other political changes which might come in the future. Thank you.